Welcome back to Let's Talk with Parul. At this time of crisis, when the world is shut indoors, almost all of us are thinking about how we can be of assistance to those who need it the most, who've been hit hardest by the crisis. The daily wage earners, the casual workers, the migrant labor, the underprivileged elderly. There are millions of those who've been left stranded or homeless or hungry because of the lockdown. What is the best way of assisting them? We are being bombarded day in and day out by messages about organizations that are doing a lot to provide support to those in need. But how do we choose? How do we know which ones are the most genuine, which ones have the maximum reach and distribution, are able to maximize the distribution of relief material to those in need? Can there be a wrong way of helping? Lots of questions, and in this episode of Let's Talk with Parul, we'll be attempting to answer them. And to help us with that, we have people who've been working at the ground level, who've been involved with relief measures from almost day one, and today we'll be discussing their experiences and sharing some advice with us. We start the conversation with Latika Thukral and Punita Chadda Khanna. Latika is the founder of I Am Gurgaon, an organization that has been working towards the betterment of the city through various projects, environment related and otherwise. And of course, they've been actively involved right from day one in COVID relief measures as well. Punita is a hospitality consultant and a concerned citizen who's been there, who's been at the ground level, and who's been working to provide as much support as she can.
Thank you, Latika, and thank you, Punita, for joining us. Latika, let's start with you to broadly understand what has been happening in terms of the relief efforts on the ground.
Okay. So to start with, I think it's an animal which everybody got it with a surprise. So there wasn't, you didn't have the time to plan. Having said that, I would give a lot of credit to Gurgaon government, Gurgaon administration, who started to put their act together. And while they were doing that, and there were organizations who were trying to help with them, what we felt that there were these NGOs who were working on the ground, and these NGOs were already on the ground in the sense that they already work with these people. So we felt that there was a need to map all the juggies in Gurgaon. And once you have the mapping done, you can take areas where these NGOs are working, so that there's no duplication. We are 10 days into it. Quite a bit is organized, but there is a lot of haphazard or ad hocism also happening, for the reason that everybody's on the ground. Everybody wants to be on the ground and serving, which I think defeats the purpose of social distancing, one. Secondly, when people are getting emotional and going on the ground and doing it, there are times there is excess food, or there are times that somebody is getting missed out. So a lot of efforts going into making this happen. There is, I am so overwhelmed with the amount of support people are giving to make this happen. But I personally feel that everybody does not need to go onto the ground. You need to tie up with people who are already working on it and give them support. One of the things which is happening is that ration is not available. So you want to help. The dry ration is not available. That's kind of, that whole supply chain has kind of collapsed. So what do you do? I mean, if the ration was, if we had 100,000 packets lying with us, we would have got a relief for 2, 3 or 4 days, but that isn't there. So you have to match it with cooking food, giving them cooked food. So there is a hell of a lot of management which you need to do. So if the food's got delivered this place, don't go back there, go to some other place, or take up areas. So if you want to do good, just take up 10 houses or take 100 houses. Just do it well for a period of 1 month. Gurgaon administration has been able to put together a kind of a website where you have the listing of all these areas, and you can pick up the areas where you're going to be taking care of. Yeah, so you can go there if you want to give, if you want to support, want to be a volunteer, or whatever action you want to take on, that is available. And if you are an NGO or a group who has already decided that I'm going to take up of this area, then just take care of that one area. Don't go all over the place.
All right. I completely agree with what Latika is saying, that a lot of people want to do good, but we have to be careful about how we do it. Otherwise, the whole purpose gets defeated. Right. So I think this website that has been put together is absolutely fabulous. There are loads of NGOs doing some fabulous work. thanks to this website that they've now developed, you can actually identify an area that you want to help. Say if you live in a certain building and there's a juggi cluster close to you, adopt that, but do it through an NGO. Don't make food, put it in your car and go running. Do it in a way that you can distribute it. I think a lot of people who mean well don't realize that there is a issue of distribution. When you go to distribute in a juggi cluster, how do you distribute? Do you make sure everybody gets it? Do you make sure that only the muscle men of the juggi don't get it? So all this we don't understand really, but the NGOs who've been working in those areas, who have volunteers who know the area, they're doing it in a much better place. And it also stops this duplication of food. And I think one thing we have to realize that it has to be a consistent effort. Aaj diya, kal nahi diya doesn't help. Absolutely. I think we need to make sure that we do it consistently, do as much as we can do. There's no need to get really, ambitious and take on something you can't handle. But do what you can do for 10 days at least, I think. Right, Latika? About 10 days?
Yeah, absolutely. Absolutely.
Like you mentioned that there are these family kits that people can create, which is 1 week's ration.
Yes.
5 kilos of atta or rice. A kilo.
1 kg of dal, oil, haldi, namak, mirch, 2 soaps. And if you can't, even if you give little bit also, I'm saying do for one person, but do it well for a period of 1 month, because this is a long haul. This is not going to die down tomorrow morning, and we will have to support them for another 3-4 weeks. So do it properly. And in fact, gurdwaras have come up, people are cooking food. I know so many people who are distributing. Keep requesting, please combine your efforts. Don't go all over the place. Talk to each other. Let's not do it just because we are, that whole thing about that I have done my bit. Right. Our bit has to also be done in a combined manner.
Right.
I had one point, Parul, that I think a lot of us, if everybody would pay their workers, right? If everybody would make sure that the workers got their salary.
Yes, you talked about the household staff especially.
Household staff, but not just, even household staff. For example, there are lots of people who help us out in our daily lives. There's a press wala,
yes,
who's now suddenly shut. He can't come. Your car washer, who comes once a month if I need something fixed, he comes. And I spoke to him and he said, Didi, jab se hua hai, ek din ka kaam nahi mila, So there are a lot of these people who actually helped us. And I think even a phone call, one is of course giving them supplies, but even calling them and asking, are you okay?
To check
do you need something?
Yeah. Cooked food versus dry ration, Latika, what do you recommend? Is there any kind of a demarcated need, or is it really on an individual basis?
So when we started, the cooked food would have made sense because that could have eased off the pressure of all of us, but the supply chain wasn't there. There wasn't enough ration available. But now what's happening is that the fuel is getting over. You don't have enough food. They don't have enough cooking gas and all that to take it on. And at this point in time, because we still don't have ration available, we need to set up cooked food. I mean, we need to provide cooked food. It depends upon which area we are picking up and what the kind of need is. But whatever you do, if you're giving cooked, please give them every day. Don't say that I will give 1 day here and 1 day there. It should go every day to them. It has to be a process. You can't give somebody a food for 1 day only.
Right. And any kind of recommendations in terms of packing to keep it safe and hygienic?
So, I have a very different view on it. And, this is something I've been arguing with everybody. I said the best thing would be to take your cooked food in your bartans and let them get their bartan and take it. Then we will add another issue of garbage. But it works differently for different people. This is my view, but a lot of NGOs have their own limitations. They don't have big bartan. They're doing what they can do best. So whatever works for people, but let's cut on adding more garbage to the city.
Absolutely.
I think there's instinctively people are making khichdi and chawal and dal because it's easier to make in large quantities. But I mean, if people have the capacity and they want to help, doing rotis, doing sabzi, taking 5 rotis, putting the sabzi in the middle, wrapping it with maybe butter paper or whatever, and then wrapping it in newspaper and tying it also secures it without causing too much damage to the environment.
And dry rations will help. If everybody keeps collecting dry rations and keep providing it to these NGOs to deliver, will really, really help.
Yes.
Absolutely. So thank you so much, Punita. Thank you, Latika. Thanks for joining
Thank you.
us.
Latika and Punita make a very strong case for combined coordinated efforts. And this is not the story for Gurgaon alone. Since there are multiple agencies working at the ground level across the country, this need for combined coordinated effort has to be across all regions. Now give a thought to who can get aid to the needy the fastest. Someone who's working in local geographies, who's connected with the local communities, knows their needs, and of course has access to various resource providers. IIM Ahmedabad seems to have cracked this code, and we flew across a digital highway to find out more.
So we welcome to this call Professor Ankur Sareen. He's a faculty member and a member of the Public Systems Group at IIM Ahmedabad. Welcome, Ankur, and thank you so much for joining us.
Thanks, Parul.
So I know you had mentioned that there are a lot of activities that IIM Ahmedabad has taken, this particular group has undertaken for providing relief at this time of crisis. You've also been working at the ground level with the Anganwadi workers and the councillors.
What we've been trying very hard to think about is who are the people, who are on the ground today, who have access to the communities or who the communities know and trust. So of course there's a response by the NGOs and civil society and even the way that we've responded, but the other folk are the ward councillors, the people who they elect. We probably don't even know who our corporators are, but the larger towns and cities, I mean, most people actually know the corporator, and the corporator is the first call for them when they need something. And typically corporators are not included, are not sort of in formal systems of governance. They work very informally.
Okay.
Who knows, in terms of their relationships and their networks and their patronage, etc. So since we've been working on this for some time, a couple of years, we reached out to some ward councillors that we were very close to and started discussing potential ideas that they could implement. One thing that we were very concerned about is, just something like, we've been telling everybody, wash your hands, soap, sanitizers, but how do they have soap? Where do they get soap from? I mean, do they have, at this point, if you are talking about a bar soap, you really want to have one bar soap to each family member also. Then, before the lockdown was in place, people were still on the streets. So if you're an auto wala, where do you wash your hands?
Yeah.
So we had a discussion, and the councillor immediately was able to mobilize. I mean, that's also the how resourceful they are. He was able to mobilize the distribution of kits the next day, which had sort of a mask, a soap, and a small bottle of sanitizer. And this was done in the community that the cooperator is from.
Okay.
And we are trying to, in some ways, by documenting it, by sharing it with other people, putting it on Twitter, etc. We are trying to get other councillors, corporators, civil society organizations to say, hey, can we also reach out to the corporators? How can we assist them? Because right now everybody is trying to also do work, right? And everybody is trying to help.
Yeah.
So what we are trying to suggest is that here is one resource that lies within the government machinery, connected to the community, that could be mobilized, that could be sort of actually be very, very critical at these times. So likewise with the Anganwadi workers, because of their community outreach, because of the roles and responsibilities they already have. So again, this is another part of the government setup, which is, on the ground, and which is aware of what is happening. And if they can be strengthened, if the challenges that they are facing can be mitigated, they could actually become essential part of the response. And so we tried to do a quick survey of, what are the challenges they're facing, where are these challenges, and how they can be addressed.
For people who do want to contribute, want to donate funds somewhere, there is a plethora of WhatsApp messages, forwards that we're getting, donate here, donate there. And there's a large amount of confusion as to, what is really going to be beneficial. Do you have any recommendations on where funds can be sent?
So my suggestion is that first priority should be if you are able to find a credible organization which is not very far from where you live. Because again, like I mentioned, it is very difficult to work in with centralized systems right now. There are organizations, for instance, like Goonj, which has a whole network of organizations under them, because they've been working on, they work on disaster relief. They've been working on emergencies. Of course, this is a completely new thing for everybody. Uh, but that's the other option, that you find a credible entity which has a network of organizations, existing local organizations, who can then quickly deliver and get need to those who desperately require it. One other suggestion, Parul, I just wanted to make was, if you know of families that, particular specific families who might be in your network, who are in need, try to ask them if there is a nearby kirana shop or a grocer who accepts payments like a Paytm or whatever, and they can go to the kirana shop and you can make the payment to the kirana shop
directly, right?
Directly. The other thing is to, through your networks, we are also trying to do this. There are other entities, and this is work in progress. But we are trying to, what are the government programs, schemes, assistance that is being made available to these communities? Because again, information transmission is a difficult thing.
Yeah.
To your local networks, also spread information on what the government is doing and what they can. For instance, in Gujarat, the ration shops have opened up today. In Gujarat, they are providing basic rations. They're saying that to those who need it, they'll do some kind of verification, but they will also provide it to those who are not otherwise who have already have an APL or a BPL card.
Okay.
But they want somebody in the society to make a list of such people, and there is a zonal officer who you submit that list to. They do some verification, but then you can get on to the basic rations that the government will provide. Because at the end of the day, the government has the scale, has the resources, that will have to step in. Civil society NGOs can only play the immediate need, and this is, we can put the first band-aid, but this is a much more serious and more deeper issue that we are tackling right now.
No, congratulations on all the work that has already been initiated.
Thanks, Parul. Thank you.
And thank you also for joining us today.
Thanks.
There are some people who cannot be termed underprivileged, but they need a lot of support now more than ever before. They are the medical community or our healthcare providers. To understand how we can support the doctors at the front line, we spoke with Dr. Sandeep Chatwal. He's a physician based in Chandigarh, also the founder of the Veerawali Foundation, an organization that works for healthcare and education for children. And they have launched the Care for Caregivers campaign that aims to provide PPE, or personal protective equipment, to doctors at the front line. Let's hear from Dr. Chatwal.
Thank you so much for joining us, Dr. Chatwal. It's really a pleasure to have you on this show.
Thank you, Parul, and it is a pleasure, and I think this is the right platform today.
Sir, you had mentioned the term PPE.
Yes. So personal protective equipment has seven, 8 things which are there. So we have a coverall, which covers your entire body, including your neck and your head. We have goggles. We have a mask, which has to be an N95 mask. And then we have gloves. We have shoe covers. And then there are also disposable bags, which have to be used when you are disposing of the PPE kit after use.
Right.
So advanced kits also have got face shields. So the number of layers have to be more in case we need to protect people who are handling COVID patients.
My other question was essentially a more basic one, which is that hospitals in any case are dealing with various kinds of infectious diseases. So would they not already have this PPE or various kinds of protective equipment already in their stores and their stocks?
Parul, that is a very, very valid question, and many people do not know about this. What happens is that our hospitals are very well equipped with our routine infections, and our routine infections are majority bacterial infections. No doubt we get viral infections, but those viruses are not so communicable. They are also not fatal, like viral infections which we encounter, chickenpox, measles, mumps, your seasonal flu. We do not get so much H1N1 or influenza here in our part of the country. But yes, we do get, but the rate of transmission is not too much. Now, the kits which we have, they protect us from our routine infections. Viruses are really small particles. They are, if I would tell you, there are viruses which are also known to infect bacteria. So you can imagine what is the size of that particle. You cannot see it even in a microscope. You need an electron microscope for that. Now, our normal kits which our hospitals have are not the kits which could save you from such an infection which is of a very high communicable nature and a very, very high fatality as we are seeing throughout the world. So this needs special kits. They have to be made of a non-woven material and they are seamless kits. So we don't have any area wherein the virus has contact with any part of your body surface.
Right.
That
So
is the difference between a PPE kit. It is a complete bodysuit.
Complete bodysuit.
And in fact, the entire world has been so overwhelmed with the demand of these kits because these are not routine things. Pandemics only happen once in 100 years. So unfortunately, this is a time where it has really spread out of proportion. And every country is facing a shortage of these kits.
Right. So what do you recommend to people who want to contribute monetarily or even in kind? What can they do?
So I would appeal to all of you, wherever you are wanting to help, get in touch with your local medical colleges, get in touch with your local administration who will get you to the local heads of departments of various institutes so that there are doctors who are involved who can guide you about the quality. I have seen a lot of people coming forward and I thank all the Indians for this. But one thing be sure, people are making an opportunity in this crisis, in this period of crisis also, and they are making a lot of substandard material which is being thrown in the market. You are donating something which you are doing it for a good cause, and if it is not going to satisfy the purpose it is being sent for and not going to keep your frontline workers safe, then your money is also wasted and your job's also not done. So I would request you join hands with organizations which are running with doctors in support. You join hands with your local administration, or if you feel that you don't want to do it at a local level, please join the Prime Minister Relief Fund.
Very, very indicatively, what would the cost of one kit be so that people have an idea?
So a good kit, a good PPE kit would be something between 2,000 and 2,300 rupees.
Okay.
There are higher end kits also which are available which could go up to 3,000 rupees. The kits which are there, which are being sold for 500, 800 rupees are not the actual PPE kits. So just be careful.
Right.
What is the sort of the kit? There are, just like we have different types of cars.
Right.
We have nano cars and we have Mercedes cars. So we have masks which are 3 rupee masks and 8 rupee masks, and we also have N95 masks.
Right.
So every mask is not the right mask which the frontline needs.
Right.
So what our Indian Council of Medical Research has classified risk of all health givers into 3 categories: the low risk, the medium risk, and the high risk.
Okay.
At this point in time, we are running the campaign for the high risk people first, because these are the ones who are going to manage the COVID patients. These are the ones who are going to sample them, and they are the ones who are at the highest risk. So the kits which are the higher end kits are the kits which are going to be used for these frontline medical people. I just want to say that we need all your love, your support, and this is the time when the medical fraternity needs your care. So give your care to your caregivers. आपका साथ हमारा हौसला बढ़ा रहा है.
We started by questioning if there's a right or wrong way of helping. From these conversations, we've understood that there's certainly an efficient or an effective way of helping. Here's a quick summary. much as we crib about being stuck at home, let's first be grateful that we have a home. Stay home, stay safe, and thank you for watching.